With that, I would like to invite my next speaker, Dr. Najum Saqib, Qureshi. He's a consultant gynecologist and obstetrician. He works in Birmingham. He's going to talk about giving effective feedback in medical education. Dr. Najum Saqib.
Many thanks for giving me an opportunity to talk on this topic, which is very important. And I congratulate the organizers that they have put quality of patient care as a theme, which at the moment is heart of the GMC considerations. All the agendas are quality assurance, quality related patients. And those of you who have seen Charlie Macy's, GMC's chief executive last week, I was quite actually startled that 75% of our fees, which we pay every year, out of 75% goes to settle these doctors in difficulty. So we need to do something about it, and that is what I'm going to talk about. Because if you are making good trainees, if you're taking good care of them, then hopefully this 435 annual subscription fees we pay, out of that 300 goes towards these doctors in difficulty. So it's a huge contribution which is going in the wrong direction. So feedback is an extremely important part which helps the doctor to progress and develop, and hopefully that will reflect in producing good doctors, and this percentage of our contribution in these cases will be saved. So I'm going to take you through in this presentation the principles of how to give feedback to the trainees and what are the various models which are available. And there's a very important issue these days. We are getting an impression that we as educators, we are not doing our job properly. This is the survey of the trainees which is telling us, but we feel that we are doing our job. So why there's a disparity? Why there's a discrepancy between the two? Normally I do this sort of workshop for 4 hours, so I will try to squeeze everything within 10 minutes. So the Kolb learning cycle is very important. Kolb was an educationist, and he said that the learning take place through the 4 things if your training take you through. So first thing is concrete experience. The trainee is very inexperienced. You're taking him through like some basic surgical skills, supervising on a minor procedure, and then he gains a bit more confidence. He can do some procedure on the real patient, so that will be, he will be reflecting on what he is doing. And then when he has gained a bit more confidence, then he can think, okay, I have opened an abdomen with a virgin abdomen, and now I'm going to open a lady who has 3 cesarean section or 4 cesarean sections. So what I can learn. So then the next stage he goes into active experimentation. Okay, so he has gone through all these 3 cycles, and now he is beginning to think, right, this patient has got a hernia protruding, and also she has got 6 scars. So what can I do? So I'm just illustrating by an example. There could be so many other ways. So this is the thing which we need to develop, and at every stage of this learning, it is the trainer's duty that they have to make sure that the patient is given, that the trainee is given efficient and effective feedback, and they can progress. There is various models. There are basically 5 most important models of giving feedback. The first is very simple, that you are just replaying as a trainer, you bring a trainee to you that you did this with me, this procedure, and these were the things you did quite well, and you take it, you replay the whole event with the trainee. So the downside of this is that you are the one who is playing an active role. Now the emphasis in the giving feedback is changing. It's changing from trainer to trainee. The trainee is the one who has to come up with what do they want. So it is of not a great deal of benefit, but in some instances it could be helpful. Feedback sandwich is a very simple thing that you tell the trainee what is good, then you tell what is not good, and then you feedback it what is good again. So you're just trying to make it slightly more palatable for the trainee. But the downside of this sort of model is the trainees switch off. They know that something bad is about to come, so they're not listening to what you're going to tell them about what is good is there. So they don't, they are just all the times thinking, let's see what's coming next. Pendental drone, I'm sure you all are aware. This is what they use quite a lot in resuscitation, and here again it's a quite extensive sort of model of giving feedback. And the trainee, it's herself or himself, they come and say what they did well, and then the trainer tells what they have done better, and then the trainee tells what they could do better, and then the trainer reinforces what you could have done better. So it has got 4 components to it, but again, it's quite useful in some instances. I think this is the one which is becoming more popular these days, is the agenda led. You need to ask the trainee, what are your goals? What do you want to achieve while you're working in my firm? So that is the thing which you need to establish right from the outset. And then you can work around it to develop the trainee. And the student and trainee centered, this is again the most important part, that the onus is now on the trainee. They need to work out how they want to develop, in which area they want to develop. So the principle of giving the feedback is very important. So as we all know, we like to hang our memory on mnemonics. So there's a mnemonic of prompted. It's very easy to remember. So your feedback have to be precise. You need to just tell what is there. It has to be absolutely relevant to what you have done. And it should be outcome based. And you need to be able to measure it, that you have been able to do a laparoscopy last time in this way, and I'm quite happy that you're able to put the second port in, but I would like you to, from next time onwards, maybe do some operative work as well. It has to be possible. You don't give your trainee a job which he or she cannot achieve, that on the first day, by the end of this week, I would like you to do a total laparoscopic hysterectomy. That's totally unrealistic. And you should be quite time determined, that we are going to give you 6 months to learn how to do some laparoscopic work. And also, it has to be encouraging. You have to be constructive in what you have to do. And in the end, it's very important. These days, you need to write somewhere, and this should go into their portfolio, that what you have given the feedback. These are the few things which you should never do during a feedback. If the trainee doesn't want a feedback, they're so stressed for something else, or they want to go and write the theater note first, do not give them the feedback. Do not bring in the past. If they have done something, just leave it in the past and move them forward and see how they can achieve. And never humiliate a trainee. Do not have an audience when you're going to give a feedback. And obviously, just make a couple of points. Don't overload them with 300, 400 points, which you can never remember, or they can't either. And obviously, if you're angry with your trainee, I think you need to chill yourself first before you do anything. Don't tell anything to trainee about after that. And especially if something has gone wrong, if they have cut ureter or anything, you need to sink this information slowly and do not start away giving the feedback straight away. Right, this is the point I think I would like to dwell 1 minute on it. And why is that? Trainees feel that, first of all, let's see the barriers. So first of the thing is, we can always fear that if we are giving a feedback, it might upset the trainee if I tell them that they are not doing their job properly. But you need to do it in such a way that you don't become unprofessional. You don't want to tell lies either. And there are some trainees now who are self-justifying as well. I just want to move on to the next one. I know the time is running out. We are dealing with a generation of medical students. This is a very important point. That's why I think I would like to dwell 1 minute on it. Who are millennial generation. These are the ones who are born after 97. So I'm not blaming them. Some of our generation have got a similar problem. They feel that they are very precious. They are very untouchable. So if you try to tell them something, they take it personally to their heart, and they are going to retaliate. And probably this is the reason that we are getting a feedback of our training, that we are not providing them feedback, which is that they're just shutting themselves. So you need to train them according to their requirements. And they have got very overpowering emotional reactions, so we need to be fully aware of them. And this lack of metacognitive development abilities, I think this millennial generation has got an insight. What we need to do is just bring it out and make sure that we fully utilize it. I've got all the reference over here. This is a chapter also from my book, and I think I've just gone over 1 minute. A marathon of a job which I usually do in 4 hours. Thank you very much.
I think we'll have time for a couple of questions.
I think training this is all in the writing looks okay, but in practical sense, there's nothing, we don't have that kind of a culture in NHS to have a feedback and be trained, and at the end of the training to have a healthy doctors. And there is a very blame culture still that anything goes wrong.
I think things are changing quite fast now, and we are moving in the direction of a better providing feedback and better training of the trainees. Gone are the days just one night before the trainees RP, you will be filling out the forms. It's incumbent on you because your hospital, your trust are very particular. They're paying you SPAs for this, and they want the value for their money. So I think gone are the days when this was a weaker issue. It is a very important issue, and they want, the trust are very keen, the deans are very, and the GMC, I can tell you, is very hot on this matter. If you're not performing well, they are saying they will take you off the training. You can't be a trainer if your report is not good.
Thank you very much.
Thank you.